All right, this is Virginia with Austin, Emily, Howie, and Taylor. The VOTA vision statement is we envision a dynamic, engaged, connected community that advances occupational therapy practice through advocacy, education, and evidence-based decision-making within the Commonwealth of Virginia.
So we got occupational therapists here with us. OT specialize in the therapeutic use of occupations for habilitation and rehabilitation to enhance physical health, mental health, and cognitive functioning. According to the Virginia Board of Medicine's regulations governing the practice of OT, or occupational therapy, OTs licensed in the state of Virginia have the following general responsibilities of assessment, program planning, and therapeutic treatment. The practice of occupational therapy may include the following roles: supervision of OT students, OTAs, rehabilitation techs and aides, administration, education, and consultation, with OT provision and services provided according to the Virginia Board of Medicine's regulations. OTs provide the following services: education and training in ADLs and IADLs, design and fabrication of orthosis, design and selection and use of adaptive equipment and devices, therapeutic activities to enhance functional performance, vocational evaluation and training, consultation concerning of the adaptation of physical, sensory, and social environments. In order to reach patient goals and optimize function, therapists must provide specific activities or therapeutic methods to improve or restore optimal function or to compensate for dysfunction in the following domains: physical illness or injury, emotional, congenital, or developmental disorders, or the aging process.
So when it comes to education, to become a licensed OT in the state of Virginia, a potential student must graduate from a college or university and receive their bachelor's degree or master's degree. It really doesn't matter the degree program in which they go through. It just matters that they complete the prerequisite courses for the school that they wish to apply to. Once they are in school and complete and graduate from an ACODE accredited and certified school, they can either receive a master's of occupational therapy or a doctorate of occupational therapy. Students during this program must complete a didactic or like in-classroom portion of the program. And for an OTD student, that's usually about 2 years and between 14 and 18 months for an MOT student. And then students must also complete 24 weeks of fieldwork. So 2 fieldworks, 12 weeks each, and OTD students must complete a doctoral capstone prior to graduation. Once a student has graduated, they can then sit for the licensure exam provided by the NBCOT, and they must score at least a 450. Once the student has taken the NBCOT exam and passed, they can then become licensed in the state of Virginia. This requires an application to the Virginia Department of Health Professions Board of Medicine. Once the therapist has obtained their license in Virginia, they have to renew it every 2 years, as well as complete 20 hours of continuing education prior to each renewal cycle. So in Virginia, there are currently 6 OT programs. You have James Madison University in Harrisonburg, Virginia, which is a master's program. Radford University in Radford, Virginia, which is a master's program that recently combined with Jefferson College of Health Sciences. Shenandoah University in Winchester, Virginia, they also have a Loudoun campus as well. They offer both a post-professional doctorate program and a master's program. Virginia Commonwealth University, or VCU, is in Richmond, Virginia, and they offer a doctorate program. Mary Baldwin University, part of the Murphy-Deming College of Health Science in Fishersville, Virginia, offers a doctorate program. And then there's us and Emory and Henry College in Marion, Virginia, at the School of Health Science that is in the accreditation process for a doctorate program. So for fieldwork, there are 2 separate fieldworks, level 1 and level 2. Level 1 fieldwork does not have a minimum number of hours, and hours are specific to the requirements of each school or program. During level 1 fieldwork, students don't have to be directly supervised by an OT. They just are supervised by qualified personnel, which could be psychologists, PAs, teachers, social workers, nurses, or PTs. And a passing grade is determined by the fieldwork coordinator for each program. and whoever is in charge of the didactic portion of Fieldwork 1. For Fieldwork 2, it occurs in at least 2 different settings. The state of Virginia, however, does not specify the specific settings. Those are mandated by each program. During level 2 fieldwork, students are supervised by an OT as long as they have been practicing for at least 1 full year. And fieldwork for MOT or OTD students is 24 weeks, 12 weeks in each placement. So patient education in Virginia is really similar to patient education for all OTs. The main goal of patient education in occupational therapy is for the client or patient to actively participate in the planning of interventions. And OTs typically provide patient education or home exercise plans in ADL and IADL modifications, stretching and exercises, adaptive equipment transfers, and energy conservation, but that's just a couple. We have a very broad scope of practice.
So now we will be talking about occupational therapy assistants. So now we'll be talking about occupational therapy assistants. So the Virginia Board of Medicine defines an OTA as an individual who has met the requirements of the board for licensure and who works under the supervision of a licensed OT to assist in the practice of OT. So some of the things that they can do, they can deliver OT services and treatments under the supervision of a licensed occupational therapist, assist in the collaboration of intervention planning. They must understand the results from an evaluation, but cannot interpret them initially for therapeutic purposes. They can state or write observations from sessions, and they need to be knowledgeable and understanding of the client's goals. They can perform reassessments and discharge plans under the supervision of an OTR. And for OT and OTA students, they are able to supervise a level 1 CODA and an OTR student that's also level 1. Or if they've been practicing for more than a year, they can supervise a level 2 OTA student. So for their education, they must graduate from an accredited program. This includes their classroom education and fieldwork experiences. And to get their OTA license, they must complete the OTA program and submit official transcripts, submit proof of a 16-week supervised field experience with the name of supervisor, pass the MBCOT CODA exam, provide a letter of verification from the MBCOT, pass a background check, complete the Virginia OTA license application and pay the fee, and complete continuing education credits every 2 years for a total of 20 CPE credits. So there are currently 7 accredited OTA programs in the state of Virginia. This includes Eastern Virginia Community or Career College, Radford University Carilion, Northern Virginia Community College, Southwest Virginia Community College, Southwest Virginia Community College at Virginia Highlands Community College, Tidewater Community College, Virginia Beach Campus, and the Virginia College Richmond.
So to build and reiterate what Taylor was saying, for level 1 fieldwork requirements, they can be supervised by qualified personnel, e.g. OT practitioners, nurses, teachers, social workers, physician, PT practitioners. There is no hourly requirement. The program specifies that program, or the program itself will specify however many hours you need to pass. With level 2 fieldwork requirements, the student must be supervised by either an OT or an OTA with at least a year of practice and a minimum of 16 weeks full-time must be OTAs must be there for at least 16 weeks full-time, or it can be part-time but not half-time. And they must receive a passing grade to pass fieldwork. Otherwise, they must repeat it. With patient education, according to the Virginia Legislative Information System, delegation shall only be made if, in the judgment of the OT, the tasks or procedures do not require the exercise of professional judgment, can be properly and safely performed by an appropriately trained OTA, and the delegation does not jeopardize the health or safety of the patient. So in other words, patient education can be provided as long as it does not require professional judgment So the OT would have to delegate that task to the OTA.
Okay, for non-OT personnel, OTs will collaborate with many people throughout the place you work. Includes doctors, surgeons, nurses, pharmacists, mental health specialists, caseworkers, PAs, PTs, speech language pathologists, rehab aides, but also your front end staff, which is like your janitors, your billing staff, secretaries, educators, and students. The responsibilities of all these people is keep the client first, and that's what OT does. Communicate effectively for the betterment treatment and communicate effectively to the patient of their outcomes. And the education for the people that we work with range from a high school diploma or GED all the way to a PhD, and there's ranges in between.